Hey, in this video, I'm going to talk to you about back arthritis and everything you need to know to understand and fix the root problem. So let's get into what is back arthritis. A lot of people are confused about this because they hear it mixed up with other diagnoses like disc herniations, pinched nerves in the back. Facet arthropathy is another confusing one, and degenerative disc disease is another common term thrown out there. And very often people have them all at the same time. So let me tell you specifically what back osteoarthritis is. And just to take a side note on that, osteoarthritis is what I'm talking about. There's different types of arthritis: psoriatic arthritis, rheumatoid arthritis, and those are other conditions that are not what this video is about. I'm talking about back osteoarthritis, but everybody says arthritis, so that's what I'm saying here. So if we're talking about back arthritis, we're discussing the facet joints that are right here. You have pairs of them at every level in the spine. We're not talking about the discs on the front, although that is technically considered a joint because it's where two bones meet together, but it's not a normal joint. Discs are not directly related to this video. They are indirectly related, and we'll talk more about them in just a moment. But right here, where I'm trying to get my nail in between where the bones touch, where this bone, this would be L3, and this bone, this would be L4, the outside part of this right here is the superior facet of L4, and the inside part is the inferior facet of L3. That's where the joint is, the facet joint, and that's where arthritis in the back happens. It can happen at any level and on either side because you have pairs of these facet joints on each side of the spine wherever the joints connect, where the vertebrae come together. Because I'm talking about the facet, facet is just a fancy word for face because the surfaces of these joints are flat like a face, and they come together and they move on each other like this. You can also be told that you have something called facet arthropathy or facet arthritis, facet osteoarthritis, and they're all kind of the same thing. Back arthritis, back osteoarthritis, facet arthritis or osteoarthritis, and facet arthropathy are all virtually the same thing. It just depends on what the radiologist decides to write on your x-ray or MRI report, or what your doctor tends to use in their verbiage. But you don't need to get all hung up on, well, I have facet arthropathy and back arthritis and facet osteoarthritis as well. They're all the same thing. Now let me tell you about the root problem. I'm going to tease it a little bit here, and then I've got a lot more about it towards the end of this video, so make sure you watch to the end. It's just the way the video fits together. The root problem here is a muscle imbalance where the back muscles, the muscles that run up and down the spine here, are being overused, and there's other muscle groups in the area that it should balance out with to give the proper pressures on the spine. But if you're overusing your back muscles, then it's going to overpressure those facet joints back here, and over time it causes arthritis problems. Now, this is my perspective on this, and I treat patients from this perspective, and they get tremendously better using this approach. But what you might hear, especially if you go to the doctor's office, is that this is age-related. It's caused from repetitive use. And to a degree, those are true, but there's also a lot of false information out there about this. And to say this is age-related, I think is just misleading, because people of all ages get this. It tends to be older people, but it's not necessarily their age that brought it on. It's the muscle imbalance over time that brings it on. So it's just that it happens over time. It doesn't happen instantly like a back spasm, for instance, where you can get all of a sudden your back starts to hurt, which is also related to time. But then we have people that are older and have recovered from their back arthritis, meaning they don't have any problems related to it anymore. They are back to normal, doing normal activities. So to say that it's age-related, I think, is inappropriate. If you're doing the right treatment, you can address the root problem, and even though you're getting older, you can get better. Now let's talk about the symptoms of back arthritis. The number one symptom, of course, is going to be pain in the area of your back, right in the lower back, above the buttock, the gluteal region, not quite your mid-back, but it is your lower back. Another associated symptom with this is having stiffness in your back, especially in the morning when you first wake up to get up out of bed, rolling out of bed. Bending over to put on socks and shoes tends to be very difficult. People will complain of lots of stiffness in their back. This tends to improve as you move around in the morning. Sometimes it takes just a few minutes. Other times it can take closer to an hour or more, just depending on the severity, how severe your lower back arthritis is. In some cases, the back arthritis can hurt not only here, but it can go into the glute area and hurt in the buttock region. And this is especially uncomfortable, and it could mean that you're getting sciatica type problems, which is related to having back arthritis. So the symptoms can spread, and that's just because the way the nerves come out of the spine here, these yellow things on my skeleton, they branch out into the legs, into the hips, they go down the back in the buttock area, they go down the front into the groin area, the hip area, all the way down into the knees and feet even. So it is possible to get radiating symptoms all the way down that are really coming from your back arthritis problem up in your lower back. Now, if you have stiffness in the morning and then it tends to get better, very often people also say that by the end of the day, their back is just killing them. So it doesn't stay better all day long, especially in more severe cases. They move, they feel better, and then they start to worsen as the day goes on, and they're just ready to go to bed at the end of the day. Now, another time that you may get stiffness is not just in the morning when you wake up and get up for the day, but also if you've been sitting for a while. Like say you've been watching a TV program, watching a movie or something, you've been sitting for an hour or more, maybe having a meal, and then you get up to move. Those initial first steps when you get up to move could be very stiff and painful in the lower back, and it could send symptoms into the hips and even down the legs. The more extreme cases of back arthritis involve pain at night. Some people just cannot get comfortable. Their back is throbbing, aching, burning. It's just painful at night. Turning over in bed can be uncomfortable as well. Just rolling over to lay on the side or to get on your back. It can just be uncomfortable, the movement that's involved in turning over. And in the especially severe cases, you may get a rubbing or a clicking or popping sensation in the back with certain movements, usually with bending forward, bending backwards, and with twisting. Like if you're turning around to look over your shoulder, that can create some popping, clicking, or rubbing sensations, grinding sensations in the lower back. Now, if you go to your doctor, you might get sent for imaging, which is x-rays, MRIs, CT scans, those kinds of things. Those are the three most common scans or imaging that you'll get done for back arthritis. And the x-ray is going to be the top one, the first one that most doctors will go to. You may get an MRI or a CT scan if they want to see if there's any nerve involvement, if there's pinching of your nerves on the sides of your spine, if they want to look at the discs as well. But an x-ray typically shows really well the arthritis that could be in those facet joints of your lower back. Now let's talk about treatment for back arthritis. The first step that people usually go through is they go see their physician, maybe their general doctor, and the doctor will probably recommend medications to start off, pain medications, oral pain medications. So they'll be taking something by mouth. Sometimes they'll also prescribe what's called a Z-Pak or a steroid, which you take by mouth. And the idea with that is to bring down the inflammation, because the very definition of back osteoarthritis or osteoarthritis just generally, osteo means bone, arth means joint, and itis means inflammation. So it means bone joint inflammation. If we talk about arthropathy, like facet joint arthropathy, which I said is kind of the same thing as back arthritis, facet joint is just talking about the specific type of joint that's in the spine here. Arth means joint, and then opathy means disease. So facet joint disease. And then you can also have facet joint osteoarthritis, which is just the bone joint inflammation of the facet. So that's just a medical terminology lesson for the day related to back arthritis. The reason why you would get that Z-Pak or that steroid medication is to bring down the inflammation of the joint and to get you some relief, but it's just temporary relief. And same thing if they give you pain medications, it's also just temporary relief. Going back to that root problem, medications don't fix a muscle imbalance. They don't make muscles stronger or weaker to provide the proper balance and movement around the joints. If oral medications aren't helping you enough, they might recommend as a next step an injection to your spine. And they can actually target the specific joints, the facet joint in your spine, to see if you can get relief in that area. For many people, this does provide some temporary relief. People can often even say they feel great. They don't feel any pain whatsoever, especially if they target the right joint. This technique is also used as a diagnostic tool to figure out if something called radiofrequency ablation might help. Radiofrequency ablation, or RFA for short, is basically where they burn the nerves that innervate, that send sensation to the specific facet joint. And I highly don't recommend that for many reasons. I've actually made other videos about this. And you don't want to get a radiofrequency ablation. As long as you treat the root problem and it's getting better, you should stick with that, because burning your nerves in the long term is not a good thing. But they'll do the injection, usually a cortisone injection, where they inject steroids to reduce the inflammation and pain, to test if it's truly coming from the facet joint. And if they find that it is relieving the pain once you do the cortisone injection, then doctors can say, well, if we do the RFA, the radiofrequency ablation, because we had success with the injection, we can get some longer term, short-term relief. I say longer term, short-term relief because it's still not addressing the root problem. It's still addressing the short-term problem, which is just getting relief to the area, but we don't ask the question, doctors aren't asking the question, what's causing the problem in the area? They're just saying, let's kill the nerves in the area. Not good. And if you're not a candidate for radiofrequency ablation, or it's not something the doctor's thinking about at this time, then they might send you for a surgical consultation. Now, surgical referral, going to the surgeon's office, they're going to, of course, take x-rays, MRIs, or look at your past ones and assess or see if you're a good candidate for a surgery. Now, the surgeries that they might offer you would be a facetotomy, which means they're cleaning up around the joint here, because very often when there's arthritis in the area, you can get bone spurs, which is thickening of bone around the area, which could impede movement or impinge on nerves. Sometimes too, there's a disc herniation related to this, and the surgeon is looking at doing a discectomy, where they cut out a section of the disc in order to provide relief to the pinched nerve in the area. These surgeries are very commonly done, and in my opinion, highly unnecessary many times. It's just that it's hard to treat the root problem because not many people out there are talking about the root problem like we do at length on this channel. Another recommendation your doctor might make is to go to physical therapy, where you might do some exercises and hands-on work to treat your back arthritis. Now, I have to caution you about physical therapy clinics, just because as a physical therapist myself, I've been in these clinics where people go to get treatment, go to get exercise. And what I can tell you from firsthand experience is that physical therapists are excellent at helping people who have just had surgery. Meaning, if you've just had a disc surgery, a fusion surgery where they put rods and screws in your back, if you've had a hip surgery like a replacement, a knee surgery, shoulder surgery, physical therapists and most outpatient physical therapy clinics are fantastic at getting those people back to moving, back to life as normal again. What they're not usually best at is treating non-surgical cases. And if you have back arthritis and you're looking to avoid having a back surgery, then going to any general outpatient physical therapy clinic is not a good idea without doing some research beforehand. You should look to find a physical therapist who is a specialist in helping people avoid surgery. And not all physical therapy clinics are gonna know to tell you this, or they don't say this when you call them on the phone, or if you look at their website, they don't always have this on there. There's more now than ever, but it's still not anywhere near a common sight to find a specialist physical therapist that helps you avoid surgery. The way you can tell that you're in a clinic that might make you worse because they're not specialists in the right way is by what they have you do and by who you see there. If you just talk to the other patients that are there, and there's a bunch of people that have had surgery, well, you're in a clinic that specializes in helping people after surgery. But also the types of exercises that you're doing for your back arthritis problem. You don't want to be doing back extension exercises, meaning they look like this. You lie on your stomach and you're lifting up your spine like this. Or there's standing versions as well, where you're standing like this and you're bending backwards, and the emphasis is on strengthening these muscles in the lower back. That is the wrong thing to do on so many levels, and it goes back to that root imbalance that I told you, where the back muscles are already very strong and used, they're being overused, and they're compressing those facet joints, leading to arthritis. It's different if you've just had a surgery, because those muscles might be weak because they would have cut into your back, and you might need to get those back muscles working again. So those exercises that I just showed you could be a very appropriate thing for you to do. But if the therapist you're seeing is used to helping people who have just had surgery, they may not know to tell you that they're not a specialist. And they may have you doing the same exercises that they have their other patients do that have had surgery, and it could make your case worse in the long run. The type of treatment that you should be looking for is hands-on treatment, where they're looking at freeing up the joints in your spine. Now, I've got specialist treatment. I'm actually a manual physical therapist, and so that's what I do with all my clients here. We hardly ever see surgical cases, and I am targeting in on each facet joint to check the mobility of each one to make sure they're all moving freely. Now, chiropractors do similar treatment. They can free up the joints. Of course, they're into joint adjustments or popping joints in your spine, so just proceed carefully with them. Where it's different with chiropractors is they may not be able to give you the right exercises to address the root problem, because freeing up the joints in your spine, although is necessary for back arthritis problems, it needs to be paired with the right exercises to fix the imbalance, to make sure that you're taking pressures off the back joints for the long term. Now let's talk about the root problem a little bit more. I had mentioned already the back muscles here are over dominant, but what needs to be worked on here? Well, there's 3 muscle groups that provide motion and stability to the lower back here. The back muscles I've already mentioned are one. The abdominal muscles that run around the front, your abs, they have some tendons that connect to the spine directly, and of course to the pelvis bones here. And the movement in the pelvis greatly influences the pressures that go through the spine. And then there's one more group, the hip flexors, which start down here in the thigh bones and then they run up into the spine. One muscle in particular directly influences the spine. It's called the psoas major muscle. You need to have balance between these 3 muscle groups in order to have the right pressures on your spine so that you can reduce the symptoms of back arthritis. This root problem that I'm telling you affects many other back issues, and this is why if you go get an MRI or a CT scan, the doctor might tell you that in addition to your back arthritis, you also have a disc herniation and a pinched nerve and degenerative disc disease and loss of disc height. They might ramble on with a bunch of scary sounding diagnoses for your back, and back arthritis maybe being the leading one or the one that they hang on the most. But the root problem for all of those conditions that I mentioned is this imbalance that I'm telling you about. And that root problem needs to be addressed in order for you to have the best long-term relief so that you can get back to normal as best as possible. Now, even if you decide, or maybe you've already had a surgery for your back, you've had a discectomy, maybe you've had rods and screws into your spine, you've had a fusion surgery or a facetotomy, you've had some sort of back surgery to help with a back problem, that does not solve the long-term problem, because if you never had that underlying root problem addressed, then it's probably still there. You're probably still moving in a way that's feeding into the problem, the root problem, and you might be exercising into the root problem as well unknowingly. And if you don't address that root problem, it's just a matter of time before you start to affect another area of the spine, another facet joint, or another disc on the front. Maybe your back is fused and you don't have any more movement in that area, but right above or right below that joint, you're starting to get the next problem. We see this all the time, and we hear about patients that have multiple fusion surgeries or multiple discectomy surgeries, and it's because that root problem was never addressed. People just go to surgery thinking that that's going to address the long-term problem, but it truly is not a long-term fix. It's just a permanent short-term fix. And we see surgeons sometimes as the end-all be-all, but that root problem needs to be addressed. Now, I've got a program that fixes the root problem of all these lower back problems, especially for back arthritis. It's called the 28-Day Back Health and Wellness Boost Program. There's a link to it in the description below in case you want to learn more about it. It's got a series of exercises that you do over a course of 28 days and measure your improvement. And it is focused on addressing that root muscle imbalance so that you can take pressures off your facet joints on your back. It normalizes the pressures on your discs and takes pressures off the nerves as well. Now we've got other playlists to address things like lumbar stenosis and disc degeneration and degenerative disc disease. They're all linked in the description below. Hey, I hope this video was helpful for you. If you've got any questions, drop them in the comments below. If you want to support our channel with a super thanks, we'd really love that. We'd appreciate that. Super thanks is the little heart icon with a $sign in it. It's in the same row as the like button. Just scroll down a bit, you'll see that. And I'll see you guys in the next video. Thanks so much. Bye-bye.